Good evening, everyone. My name is Fary Khan, and today I'm going to talk to you about the International Day for the Disabled Persons, which is this Sunday, the 3rd of December. And from behalf of the ISPRM and all the presidential cabinet, we are all committed to broader global initiatives that tackle barriers for inclusive health and equitable healthcare. From this perspective, we know that globally we have almost 1 in 7 persons worldwide who have some form of disability, and many of them are in the low and middle income countries, and they are often disadvantaged significantly because access to universal healthcare is not yet available in many countries. For some of the developed countries, we're very fortunate. Therefore, the launching of the Disability Action Plan worldwide is incredibly important. We know that initially we've had this Disability Action Plan that was from 2014 to 2021 endorsed by the WHO, which was basically looking at removing barriers for people with disability, providing equitable access and inclusion of persons with disability. And that is now part of the Rehab 2030 plan, as many of you know. And one of the most exciting news this year was in May of this year, when the World Health Assembly endorsed the WHO resolution on rehabilitation, which was really to strengthen rehabilitation within health systems. And this is a very important landmark announcement because it recognizes that rehabilitation is an integral component of healthcare for persons with disability, and that it is not just that's not just looking at people from health services perspective, but also should include health promotion, health prevention, palliation, and a strategy generally that should be used for all persons, patients or disabled staff working in hospitals and consumers, etc. Now, with this in mind, the hospital I work with in Melbourne launched their own Disability Action Plan, which is a huge step forward for us because our Department of Health and the government endorses alignment with the Global Disability Action Plan. And in this context, timely, safe, effective access to healthcare services for persons with disability and rehabilitation are really integral to good care and good patient outcomes. So with that in mind, just from the Australian perspective, we have about 4.5 million persons with disability in Australia. And of these, almost 80% have significant physical disabilities. Of course, we know there are hidden disabilities with pain, bladder, bowel, and incontinence, and so forth. And a very large number, a quarter of these people face discrimination, whether it's patients in terms of access to hospital or it's staff working in many of these hospitals. So with this in mind, in our hospital, there was a Disability Action Committee that was formed, endorsed by our executive, and basically they highlighted some of the key priority areas that would help us endorse and implement a Disability Action Plan. And some of the things that are included in this include, for example, equitable, timely access to health programs and services, which is pretty integral, isn't it? And access to information, which persons with disability can easily access and understand and follow through, or have help if they can't follow through. And then things like looking at attitudes, knowledge, practice of people who deliver health services, and how we can change that in a more positive manner to enable people with disability to have better access and better understanding of what services they are meant to access. Similarly, we also looked at inclusive employment, for example, getting people back to work. It's so very important. And within the hospital structures, basically look at physical environments that promote access for people with disabilities so they can move around in hospitals. There should be ramps to access garden areas, for example, or cafeterias and so forth. And we often don't think of them straight up. So with this in mind, our hospital also set up a really good monitoring and accountability framework. And basically what we did was that, in alignment with our Department of Health clinical care standards, which are mandatory, Standard 2 basically means partnering with consumers. So we have a consumer advisory committee that then works with this standard in mind to enable the hospital disability action plan to be implemented. And we also have the Australian Network of Disability and Access and Inclusion Index tool. So when we do implement our key performance indicators, we can actually look at how we are performing in that context. It's not just verbal endorsement. Is actually meaningful and basically, is effective, and we can report back to the authorities about where we are and how we can improve moving forward. And with this in mind, I'll give you one example of services and programs. So one of the, for example, the actions that we have is that we implemented a disability identifier tool on our electronic medical record. And this is very much a self-determined need for consumers for care delivery. So consumers themselves are putting down what they feel their needs are. And this kind of consumer index really allows medical and non-medical staff who have access and permission to use that information to be able to assess how the patients feel that the needs are being met or not, and where are the deficiencies and what can we do to improve that. Similarly, raising awareness for people with invisible disability, for example, pain or bladder bowel dysfunction and so forth, making sure that they're not missed and they have access to all services. But that also includes digital health steering committee work, so they can also access electronic information and media. Similarly, we also looked at what are the barriers for our patients and for our staff with disability within the hospital, for example, or the precinct, for example. And that again helps us plan those spaces, plan the work allocation descriptions, change work for people who may not be able to perform those duties by retraining them into more appropriate job descriptions and so forth. Similarly, strengthening partnerships across the precinct where, in our precinct, we have the University of Melbourne and we have 3 major tertiary hospitals in that same precinct. So how we can be uniform and work with each other to potentially enhance the experience of people with disability in a hospital setting, for example. And also to look at staff that have disability. They may not have disclosed it. If they do, then what are we able to do to assist them so that they feel more productive and more a part of the community and a service of that institution. Similarly, we have set up ways and means to set up KPIs that target specifically how we can improve awareness of people with disability within our region, in our northwest part of Melbourne, and how we can liaise with various consumer disability groups, and how we can quantify what we're doing and who is going to action a particular action and whether it meets the KPI and the set standard or not. And so this is a 3-year plan that we've implemented, and it will be launched very soon. As we know, 3rd of December is the International Day for Disabled Persons, and this is an incredibly important initiative moving forwards. And I guess I want to share this with you because I believe that many of you as rehab physicians in your hospitals, in your services, in the universities that you are affiliated with, we can all promote awareness of disability, awareness of rehabilitation services, awareness of the fact that the WHO resolution on strengthening rehabilitation health systems is now there to stay. And it's not just lip service. We really need to action the key performance indicators and have accountability for those actions to be endorsed and have a way of evaluating those outcomes so that we can have this continuous improvement cycle. So on behalf of the PC of the ISPRM, I thank you for your time and attention and happy for all feedback. Thank you.